Yeah, I'm Trevor Fossey, and I'm part of the Coalition for Collaborative Care as a patient member. And I was asked to give this presentation and to be involved in the co-production of the model on the basis of the fact that 12 years ago I became partner for my partner. I became her carer. Her name is Jenny, and she had dementia. It's not progressive, but she's got fairly poor executive functioning capabilities. I've also myself had a couple of strokes. I've got long-term diabetes, so I was picked on as being someone who could produce in a cooperation with the Think Local Act Personal people, and Andy I met at that occasion, and it was a gathering of people who had the experience to come up with what they saw as a model. It was facilitated so that it was gathered the information, and we came up with a number of things that were important to people, and you're getting shared between yourselves a copy of the poster so that you can see them, but I'll go through them on the slide. We came up with a model of the information of what good care planning and support looks like for the individuals who were in that room, and what feedback that they could give. And I've been asked to go through this model and probably share my experience of my journey with Jenny and how we've had some good help and good support, and myself, but where it could have been improved. So we're going to go through each of these boxes. What we've also provided to you is a second piece of paper with the boxes in there that you can rank yourself in each of these areas that I talk about, where I share my experience. And an interesting comment that has been made is that you can also use these boxes to ask the people you're supporting, if you're in that situation, on their feedback. How do they rank you? Is there a difference? A sort of 360 feedback on your own way they feel you're supporting, because often your perception isn't the same as the people's experience. So basically you can go through that as we go through this, but I'm going to look at each of these boxes on that model in turn. First one is I'm trusted to write my own care and support plan with whatever help. That came across as one of the most important things of saying, trust me, it's my plan, it's my life. You're supporting me to live my life, and I'm involved in it, I own it, and I can create it. In Jenny's case, she had been in hospital for about 15 weeks, and in Jenny's case it was decided by the NHS she should go in a nursing home, which I wasn't happy with, and I had to fight. I became an advocate really on that side. And a case conference was held. And the feedback that I got was from the social worker who was trying to handle this. When I said Jenny's coming, I'm going to get Jenny to come into the meeting, was, no, we don't like those people when we're talking about them to be in the room. As far as Jenny is concerned, she's a very independent person, but most of us are anyway. But she valued her independence so greatly. And I felt it important to get her involved totally. Although I knew I would be advocating and talking for her, it was important to me that she knew that she was there and she'd felt being there and she hadn't been excluded. So she did attend the meeting, and she didn't say anything out of turn, but it helped her with her well-being. And I thought it was strange that maybe for her own benefit, or the social professionals in the room didn't feel comfortable with her being there. But basically they've got to be trusted. That's for the individual. If we look at the next box, my care and support plan is about my whole life and not just assessing my needs for money, because we're talking here about personal budgeting and support that you're getting. As far as I was concerned in experience, that is very important. As far as I needed support, was the fact that I needed to continue working, but she was going to have her time. So I needed some support, and the care worker, because I was making a few noises and advocating, said, okay, we'll work out a direct package payment, which was good. Didn't only look at the money side, they thought, what's important for Jenny? I had a particular aspect of my work that I was involved in a role that required me to go abroad at meetings. It was a global company. So I feel comfortable in leaving her alone for some of the time, but not overnight. So we needed some support workers. I quickly got thinking about the care and support to the fact that Jenny didn't want care. She didn't want care workers. She's very independent. She didn't need care to her mind. She felt that she could do her own things. She could wash herself, dress herself. But she did need support and depend on support, but didn't like admitting it. So she has personal assistants right at the start. And they helped with our solution. It was a full care package. That was a good part. In fact, it broke the mould with a social worker because of advocacy. It was the first one in my local area, just outside Birmingham, in the Black Country, that gave a support direct care payments package for someone with a mental condition. It had all been physical in the past, but it was for Jenny with a physical mental condition. Looking at the next couple of areas that are important within the plan, that I'm encouraged to think creatively about ways to achieve my outcomes. That's what we as individuals felt important, that the people who are supporting us have the experience. They can think about how it can be achieved. They've seen it be achieved in the past. So if we've got an outcome that we would like, both the person being cared for and the carer would like their input, think creatively, come up with ideas. And that if I need help to plan, I can choose who supports me through the process and put the plan in practice. Don't be judgmental. If someone chooses someone who you think isn't very good in it, doesn't matter. It's for that person to decide who they can engage with their own plan. Felt that there were a couple of people we were involved with who were a little bit judgmental and thought, well, Jenny can't make that sort of ideas, we know better. Paternalistic. Although they weren't openly paternalistic, it was just the perception that came across. Now they felt that, I got the feeling that they felt, well, we know better than that. I suppose the best one, or the one that most brought that home, was I was asking questions, and I got ideas from elsewhere about Jenny having to go to a nursing home, and I found from a consultant in Australia who I spoke to via the internet that he said about it was possible for her to get some rehabilitation and get a good life, a good quality life and well-being, and I proposed that. And I was told by a senior consultant at the hospital, in fact warned, he actually waved a finger at me and said, it's people like you that make it worse for patients. You know, it was such a way of trying to put me down. Unfortunately, I was in a career which was project leading and have dealt with objections in the past, so I was able to handle that and be the advocate. But a lot of people would have been put off, I would imagine. So really we need people who actually choose to plan. That consultant would have said I wasn't the person to help Jenny achieve her well-being. So you need to respect the individual's rights in that way. The next one is that people who support me to plan have a flexible, open, honest, positive, solution-focused attitude. Total attitude of not saying we know better, but we're going to try and achieve you, or helping you achieve what you want to do. This is the way that it can be done. This is what's going to lead to your well-being. So let's go down there and give you the support and think creatively. You can't do that, for example, but you could achieve the same output by doing it this way. That's what we're looking for, with experience of the individual. You've got experience. What's worked for others might be worked for us. And we had some advice on that as well, and I could take it on board. And they can involve my friends and family, going back to that other previous point. If the friends and family, that might be conflicting, there might be people in the family who think differently, but hey, it's our choice as carers and support, you know, the person who's being cared for, to choose who we want to listen to and whose ideas we can take on board. We then look at, I have all the information I need to plan. when I need it, in an accessible way, including signposts available. The direct payment scheme was very good in doing that. Our experience was that it was good. They lined up a number of people who came in to support. It took us through what the requirements are, the managing and the administration side. The not really looking at accessibility, because I've got loads of books of papers and documents regarding all that. But I prefer it on the internet fine. I find it easier. And the problem with paper in our situation is that Jenny resents thinking that she's got care. She thinks it's an attack on her independence, although she does need it. And if she sees a paper that says something about care there, if I'm not there, she'll throw it away. And then 5 minutes or 1 minute later, she'll forgot she's even touched it. But to her mind, she's dealt with it. She's got rid of it, and that's okay. I prefer it on the internet. I can print a copy, give it to her. I've actually digitalised some of the information that's important to her and some hints on her well-being. And I put it on the notice board at home and share it with her that way. And I often find that when I'm not there, even though she'll dismiss it when I show it to her, I'll find her sometimes standing there reading it and taking it on. She's actually coming to terms with it and accepting it, which is important to help her build up her strategies. So the information needs to be available in an accessible way. Computer wouldn't work for everyone. I think it's more accessible because it can be translated and turned into bigger text, or can be read out if she needed it. But it's really for the individual. We would just effectively tell them, this is how we've got it, that's how you're having it. Effectively, I had to make it work. I'm supported to take risks. Now, everybody in this room takes risks. They've got a decision. They decide what they want to do. You mitigate those risks, or you think that's not worth the risk taking, doing this, or even when you're driving, you decide, do I quickly go through this orange light before it turns red? But it's amazing how many people are being supported with an LTC. It's assumed that they haven't got the decision to take risks. They've not got the ability. Today, Jenny's on her own. We've got strategies and that. I know she's safe. If she wants to go out the house, she goes out. It's her decision. She's got the mental capacity to take decisions. She won't always assess the risk adequately, and as I said before, I wouldn't leave her overnight because there might be other risks there. But she can take risks. She enjoys the independence of making up her own mind. And that's important to her well-being and a feeling of assurance and self-esteem that she can do that. And that's sometimes forgotten. I know when we were looking at a care plan for her, we were effectively told, well, she shouldn't really be doing that. Should you only be letting her out when everything's you're with her? And as I said, well, if I wanted to keep her locked away or not let her out and have her freedom, I might as well put her in a home. Why not? But she is developing, and it's interestingly, with her being able to take the risk, she has developed strategies to help her to cope adequately. She can now cope with the fact that she's got effectively a 1-minute memory. That's what she's got. The process for assessment through to review is transparent and clear, and that's a personal passion of mine. I believe in transparency. I've worked with a global company that we achieved a lot of things through transparency, and I believe it should be transparent. I like the fact that I can order something on Amazon, for example, and I can see at what stage it is, what time it's coming, everything like that. That's an expectation now. But Jenny, this is one criticism I have. Jenny had a care plan 12 years ago. It was reviewed in the first year. And since then, I haven't seen her. I haven't shared it. They haven't been to see her at all in that time. As far as they're concerned, I've taken advocacy and I'm making sure it's working for her. She visits the doctor once a year. She's not on medication. So as far as, apart from the fact when I was once away a few years ago, she fell and broke her hip and had an operation, but you know, that was her last episode in hospital. But she's not had any other any things subsequently that have caused damage. But I still haven't seen the care plan. I've asked for it. I've asked if I could go online and see it. And I say I'm passionate. I can actually see my full GP record online. I can see Jenny's GP record online. But I can't see the care plan. I don't know why. What's the secrecy? Why can't it be shared? I'd like to know the process. Thinking back to the time I got the direct payments, I'd like to know where the process was. Well, it took weeks and weeks for it to come through, but I just didn't know the process. I was just told, yeah, it's in the pipeline. We're fighting for it. It's new. It's, you know, I'm fighting the case. The social worker did fight the case and got it through in the end, but it was like a secret process. It was being done behind closed doors, effectively. But people have an expectation these days to know what's happening, when it's happening. They'd like to see, I know I'd like to see the care plan, I'd like to see the social record. I could probably contribute something, I could probably use some of it, learn from something, not just be told face to face when I'm concentrating on the discussion, but to sit down and contemplate the information. And that's my benefit from my own personal record. And my view is person-centred. This was the biggest area that we did find people had issues with. The social worker came for the review, clearly just thought she wasn't person-centred at all. She'd almost brought her speech like she said it before and tackled other people with issues. She thought Jenny's got dementia, so we'll talk about the plan. And the social worker said, well, how does she feel about this? And Jenny, as I said, since that first meeting, I've always had in every meeting. I won't have a meeting without her. It's about her life, so it's got to be about her. And Jenny picked up on this and said, who's she? Do you mean me? If you're talking about me, talk to me. She also said to Jenny, thinking about the fact she didn't have, she had issues with her memory, she said, well, last year you did signed a contract for direct payments, and it's got some clauses in it, but you won't remember those, so it's not worth talking to you about them. And Jenny said, well, as a bit of background, Jenny used to be a senior partner's legal secretary, and she won't sign anything without reading all the small print. Even if I'm with her and we're buying something, she wants to see every bit of small print and make sure it's okay. And her response to the social worker indicating she wouldn't remember anything, Jenny said, well, I'll recognise my signature and I wouldn't have signed it without reading it, so I know it's true. And there's little things like that which did upset, as far as Jenny was concerned, that made it feel that she wasn't being listened to. As far as overall, I would add that the overall package that we got, the overall support that we got in general, as I said, breaking the mould as well, really indicated the importance of having someone who didn't mind being a strong advocate and didn't just accept being put down by people and said, no, we're fighting for what we're trying to achieve. And it has benefited her that, as I said before, she is at home alone, she is safe, and she feels, I think she enjoys being alone sometimes because she feels in control. It sort of endorses her independence. So these were the areas that we actually talked about at our meeting. And different people looked at them in slightly different ways because everybody's experience is individual. But I've tried to pick up on this where our experience or my personal experience was and the importance of areas of that is concerned. And I would suggest that you use the model and the extra part with the boxes on and the self-assessment, not only to assess yourself and your team, but to get feedback from your own individual users, from the carers and the people for whom support is being provided, to see if their perception and their feeling is at the same level as you. And they can fill in the box and say, yeah, this is what I'd like from my support to match my expectations in this area. So thank you for letting me share that. Thank you very much.